Welcome you all for this enteral nutrition calculation class. Enteral feeding means intake of food through Ryle's tube into gastrointestinal tract. Enteral nutrition is essential for critically ill patients who face difficulty in swallowing oral diet to compensate their high calorie demand and protein sparing action. Nasogastric tube starts in the nose and ends in the stomach. Orogastric tube starts in the mouth and ends in the stomach. Nasogastric tube starts in the mouth and ends in the intestine, including nasojejunal and nasoduodenal tubes. Orogastric tube starts in the mouth and ends in the intestine. Gastrostomy tube is placed through the skin of the abdomen straight to the stomach, including percutaneous endoscopic gastrostomy. Jejunostomy tube is placed through the skin of the abdomen straight into the intestine, including percutaneous endoscopic jejunostomy. Before starting the enteral feed, the dietitian must know the basic nutritional requirements. These are the standard calorie per kg per body weight for underweight, normal, and obese people. We'll see an example for nutritional requirement of an normal person. Mr. X with actual body weight of 58 kg and ideal body weight of 64 kg, his calorie requirement should be calculated with standard recommendation of 35 calories. His carbs calculation will be calorie divided by 4 multiplied with recommended percentage. His protein requirement is calculated with actual body weight into recommended gram of protein. For fat calculation, the calorie divided by 9 multiplied with recommended percentage. Let's see an example for enteral feed calculation. In an emergency case, the RT feed started at 60 ml per hour. First thing needed to consider is formula selection. Second thing will be dilution factor. Third thing calorie calculation and protein per scoop. Now calculate the fluid for 24 hour. Then calculate the fluid with dilution factor which gives scoop value. Now calculate calorie per scoop into total number of scoops which gives total calorie per day. Same way calculate protein per scoop into total number of scoops which gives total protein to be fed. One more example we'll see for standard enteral feed calculation. Mr. X with known height and weight opted for nasogastric feed. His energy need was 2000 calories and 80 gram protein. For this case, 1.5 calorie per ml product was chosen with 63.8 gram protein per liter. His estimated calories calculated by total calorie per day into the product calorie per ml, which gives total ml, which is further divided by 24 hour gives ml per hour. The formula is reconfirmed by multiplying the ml per hour into 24 hours, which gives total ml to be fed. Further, it is multiplied by calorie per ml of product, which gives total calorie per day. Protein is calculated by total ml per day into protein per liter, which gives total protein per day. If 1 ml per calorie is equal to 2000 calorie per 2000 ml means then total number of ml per day into amount of free water per liter gives an approximate ml per day, which gives further divided into times of feed to be administered that gives ml feed per serving. Now let's see one more example for bolus feed. A patient with known anthropometry measurements with comorbidity administered with percutaneous enteric gastrostomy and initiated oral with limited calorie protein and carbohydrates. His energy need was found to be 1800 calorie and protein and carbohydrate. 1.2 calorie per ml product was chosen with protein and carbohydrate per liter. The ml per hour is calculated for 24 hour and further multiplied into product's ml per calories, which gives total calorie per day. It should be added with oral calorie intake. The total fluid per day into protein per liter gives total protein per day. It should be added with oral protein value. Same way, the carbohydrate per liter into total ml per liter gives total carbohydrate value. The oral carbohydrate intake should be added along with this. To calculate fluid requirements, if 1 ml per 1 calorie is 1700 to 1800 ml, the fluid per day is divided by number of feeds gives ml per serving. If we assume 1750 ml per day means it should be subtracted by free water, which gives how much extra ml to be provided. Through bolus, 30 ml will be flushed before and after feed. Remaining fluid will be fed through oral. Let's see one example with fluid restriction. A person with known height and weight opted for RT feed. His energy need was found between 1500 to 700 calories with protein. 2 calorie per 1 ml product was chosen with protein per liter, and the fluid restriction was found to be 1.5 liter per day. The estimated calorie per day into 1 ml per 2 calorie gives ml per day, which is further divided by 24 hours that gives ml per hour. It is reconfirmed by ml per hour into 24-hour gives total ml per day, which is multiplied by 2 calorie per ml that gives total calorie per day. The protein value was calculated by total ml per day into product's protein per liter gives total protein per day. Fluid restriction was found to be 1.5 liter per day. Total ml per day into free water per liter gives how much ml of water per day to be fed. In fluid restriction, we need to see the micronutrient dietary recommended value. The recommended dietary value of micronutrient is not met, so multivitamin supplement is to be administered. In the case of emergency, weight-based enteral feed is given temporarily, referring to the chart. Only ICU dietitians are allowed to calculate the calorie need in their absence. Physicians can prefer this chart. This chart gives guidelines not intended for medical use. Another emergency method is volume based calculation. It should be used with caution. The hour rate should not more than 150 ml per hour. Nurses will assess intolerance such as abdominal cramps, diarrhea, and vomiting per 24 hours. Also, the gastric residual volume should not be higher than 300 ml. Calculate the feeding goal for 24 hours. For example, if the total volume per day to be 1800 ml, the feeding rate per hour will be 75 ml. If the patient was already fed 450 ml over 6-hour period, now the feed is holded for 5 hours. In such case, total volume minus fed volume gives remaining ml to be fed. The timing will be calculated as 24-hour minus time fed minus withheld number of time, which gives 13 hours. Compare these hours and ml with the chart following below. The instant volume based chart shows 104 ml per hour to compensate the remaining feed. This is the volume based chart. The ml is given in column and hours are given in row. Let's see what is gastric residual volume. Gastric residual volume refers to the volume of fluid remaining in the stomach during enteral nutrition feeding. Nurses will withdraw this fluid via feeding tube at 4 to 8 hours interval, which are measured and withdrawn to patient's stomach. Avoid fluid, electrolyte, and nutrient loss. If the GRV is up to 500 or less, means it shows the gut is functioning properly. If it exceeds, means the GI tract is delaying the digestion process, which leads to aspiration. So the nurses withheld the enteral feed. Reference of a research paper. The research suggests that there is no relationship was found between aspiration and gastric residual volume. The efficacy was found to be low. Hope you have learned new things. Thank you.